What is up everyone, and welcome back to my channel. If you're new here, my name's Lauren. I typically like to upload speed cleaning and organisational videos, as well as some home renovation updates here on the channel. I have fairly recently entered the pregnancy journey world, so a majority of the content, including today's video, will be about our pregnancy journey. For those that don't know, we are currently expecting our first baby in June this year. In just over 10 weeks time. I'm 29 weeks and 6 days pregnant, and we're expecting a little boy. Like I said, today's video is pregnancy related. We are doing a pregnancy and diabetes Q&A. Before we start the video, if you're not already subscribed, don't forget to hit the subscribe button and hit the notification bell to be notified of any new videos on the channel. I do try and upload on a Sunday at 11 AM Greenwich Mean Time. So I did ask over on my Instagram, I will leave the handle down below somewhere, on what you would like answering in terms of pregnancy or diabetes and pregnancy, because the content at the moment focuses around about how I'm controlling my diabetes whilst pregnant. I do some diabetes content, although it has taken a bit of a back burner since becoming pregnant because I'm kind of merging them into one. But I did ask what pregnancy and diabetes and pregnancy related questions you wanted answering, and I have a few which I am going to answer in today's video. So we'll just get straight into it. The first one isn't actually a question at all. She just put, not a question, just wishing you all the best. You look amazing. Kiss, kiss, kiss. Which I just thought was really sweet for her to say. I know personally I have been looking quite dishevelled, uninterested in my appearance, everything like that. I haven't made an effort at all. I have just vlogged today actually that I wanted to do a bit of a pamper session and a bit of a self-care session, because throughout the entire pregnancy I just haven't really looked after myself. I haven't really cared about what I look like, and you know, I've been looking back at some of the vlogs I've done and I just think, Lauren, just put a bit of makeup on, you know. Just eat a bit healthier, you might, you know, your skin will look a bit better if I do that. But the picture that I inserted with the story, I'll put the picture on, you'll see it. I had my bump out, I was looking happy, I looked like I was making an effort. So it was nice for her to say that I was looking amazing and that she wishes me all the best. So thank you, I did already thank her for that lovely comment. So the second question, this is from one of my best friends. She wanted a shout out. So Amy, if you're watching, thank you for the question. She goes, have you been scared knowing the risks diabetes can have on your pregnancy? And if so, how have you coped? Yeah, so I've always been aware of the risks diabetes has on pregnancy. That's pretty much why I was doing a diabetes journey on my channel before I became pregnant, because I wanted to try and put myself in the best position for myself and for the baby if I was to get pregnant. Thankfully I did, and it's because of that preparation I did, the pregnancy's going quite smoothly. Had I not have taken those precautions prior to conceiving, my anxiety throughout this entire pregnancy would be through the roof. I really don't think I would be coping well. Don't get me wrong, I've gotten so much support from the medical teams involved in my pregnancy, but I've always been fully aware of the risks associated with high blood sugars and pregnancy, and even low blood sugars in pregnancy. I am classed as high risk, so there's multiple risks that can affect this pregnancy. Even if it's a smooth ride, towards the end of the pregnancy I could develop preeclampsia, for example, and that in itself is quite a threatening condition to have. So yeah, I have been aware of the risks, and in terms of coping, I think, as I say, it has helped having the medical team that I have had always telling me that I'm doing a good job, despite blood sugars being higher than normal. They're constantly saying that I'm doing a good job and that you shouldn't be putting yourself down, and that's helped me cope a little bit. I haven't got that many people I can talk to about this, hence why I'm doing this journey on the channel as well, because I would like to hope I'm helping some type 1 diabetics who are pregnant and are going through the same thing. I'd like to hope that this journey is reassuring them that you can have a normal pregnancy despite there might be risks. And it's just how you cope and having that support bubble, and I'm finding that the medical team are quite a good support bubble for me. So I'll say I'm coping well with the people that are involved with my care. That's really, really helped relax me a little bit better. Just relax me throughout this thing. Next question, have you got any cravings? So I'm in my 3rd trimester now. I don't know when cravings were meant to stop in the pregnancy or if they'll just continue throughout the entire pregnancy. I can't say that I've had any cravings at all, which is quite odd. It's one of those things I totally expected would happen. There was a period of time where I was eating, it was a combination of both Galaxy caramel chocolate and something else, but I can't quite remember what that was. I'm sure there was 2 things together that I really enjoyed eating together. But I definitely know Galaxy caramel chocolate was high up there for things that I wanted. Every time one of them popped to the shops, I would always get a Galaxy caramel chocolate. I did mention that to Darren. I said, I think that's one of my cravings. And he goes, Lauren, that's not a craving. That's just your typical diet, which is true. I can't say I was overly craving it. I wasn't like desperate to have it. There's been no foods that I've desperately wanted. So I probably haven't had any cravings throughout this pregnancy, which is quite weird. Very, very recently though, I have started eating a Satsuma with my iron tablet. It's a bit of vitamin C, and I don't know if it's just these Satsumas that I'm eating, but the juiciness of them, oh my god, they're so good, and it just makes me want to have more of them. So perhaps that is a late craving that I'm having, but other than that, I'm going to say I haven't had any cravings. The next question, anything you expected about becoming pregnant that changed when you actually did? I like that question because yes, there was a few expectations about pregnancy I had which haven't happened. Quite shocked about that. One of them being the cravings. The biggest one for me, and bear with me, but when you become pregnant, you're obviously told that your body is changing to bring in this beautiful new life. Everything's changing, hormones are rushing everywhere, and your boobs will start to grow. No, they don't. At least mine certainly haven't. I was expecting a huge chest considering I'm quite small chested anyway. I always thought before pregnancy that, oh, I've got a small chest. I've always had to deal with a small chest, but at least they'll grow when I become pregnant, or if I become pregnant. And well, I think they'll just stay the same size. I'm still wearing the same bras as I have done since before pregnancy. I've actually had to ask the question on some forums. Like, I've got the Peanut app, and I had to ask on the Peanut app, like, is anyone else small chested and expected the boobs to grow during pregnancy? Because mine haven't, and I'm getting a little worried. Am I actually going to be able to breastfeed? And thankfully, a lot of people said they were in the same situation, and once they give birth, their boobs just BAM! So fingers crossed that that might happen to myself. Not that I want huge boobs or anything. I'm content with my body as it is, but it was just one of those things. I totally thought that that I would get bigger boobs. So that was one expectation. The cravings I expected to have, and I haven't had any cravings. I think the third one, and I think this is quite a more serious one, is the expectation that if you have a big bleed during the first trimester, for example, or any time during the pregnancy, but for myself it was noted in the first trimester, I had 3 big bleeds in the first trimester, and my expectation was, and sorry, this might be a trigger, but my expectation was that if you had a big bleed during the first trimester or any time during the pregnancy, you were going to miscarry. And thankfully that isn't the case. I think society has kind of drummed it into you to be wary of things like that, but it's the top thing that you kind of see when you're looking for answers around bleeding in pregnancy, is that it's likely to be a miscarriage. It's not the case, and I found that out myself because I've had 3 big bleeds during the first trimester, and I think we just need to quash that expectation because it's not always true. There's many other reasons why that could happen, and although I didn't get to the bottom of why I was having big bleeds, I'm just thankful that I'm still progressing with a healthy pregnancy. So I think we need to quash that expectation and not stress too much about it. Sure enough, be aware that, you know, a big bleed is something to be cautious of and needs investigating, but don't automatically assume that it's the worst. And I think we just need to try and reassure people and expectant mothers that it's not always the worst case scenario. So I hope that was a little bit of a reassurance for you if that was one of your expectations as well, becoming a parent. Right, are you scared for the labour? Yes. Yes, I am. I don't think there's anyone that's not scared for the labour. They might be more excited than scared. There will be nerves involved, but I am 100% scared of the labour, especially now that I might have to have a natural birth. So as a type 1 diabetic, I've explained this in some of my vlogs, that as a type 1 diabetic, it's likely that you have a bigger baby, in which case you're more likely to have a C-section. So all throughout the pregnancy, I've been gearing myself up to have a C-section pregnancy, which I've been quite relaxed about. Obviously, the aftercare of a C-section is a little bit daunting and a bit worrying, but just to welcome baby into the world, I thought a C-section might be quite nice to have. And I was told recently at a consultant appointment that they would recommend you didn't choose to have a C-section, particularly as a type 1 diabetic. You should consider a natural birth. Well, I've been gearing myself up for a C-section for all this time, and now I'm being told that I might have to have a natural birth. Is really, really daunting and scary, and like I've got 10 weeks now to really plan for it, and I haven't even thought about a birthing plan or anything like that. I'm kind of one of those, I would just go with the flow and then panic when it happens. But 10 weeks until due date, I think I need to get some kind of birthing plan sorted now that I might have to have a natural birth, and look at ways I can cope, because I am 100% scared. The thought of the pain, I don't do well with pain anyway. Period pain, even, oh God, that kind of pain hurts so bad. Any twinges I'm having at the moment feels bad to me. So the thought of actually having contractions and going through labour naturally is really, really frightening. But it'll all be worth it in the end. Really excited for the final outcome, but yeah, I am scared. Next question. I've just found out I'm about 6 weeks pregnant with diabetes and so scared. Tell me it'll be fine. Well, first of all, congratulations. Fantastic news. Do not worry about it at all. You've got diabetes and you're pregnant. Now, I can't give advice or anything like that. All I can say is that it will be fine. Likelihood of it is you've probably already prepared prior to conceiving. If you haven't, that's fine. Your diabetes team and the medical team will help you to get control of your diabetes. Now that you know, take control straight away. Right now, start doing everything you can to look after yourself during this pregnancy. Cut back on any sugars, cut back on any carbs, exercise, you know, look out for yourself as if you weren't a diabetic and you were pregnant. Just minimise any kind of risk you can, and you know how to do that yourself as a type 1 diabetic. As soon as I found out I was pregnant, I really looked at my insulin intake and my sugar intake and started to play around with my insulins to make sure I was really keeping my blood sugars on target. So yeah, it'll be fine, don't worry. Always be in touch with your diabetes team if you've got any questions. They will support you. Your midwife will support you, the pregnancy assessment team will support you. Everyone will be on board to help you have the healthiest pregnancy you can. So don't worry about it. Don't be scared. It's so exciting. I'm so happy for you. What is the best thing about pregnancy so far? I don't know, because I'll tell you what, you probably know from the first trimester that I really didn't enjoy being pregnant. Obviously all the worries and the stress of the big bleeds actually made me say, I don't think I can do this again, which is a horrible thought. You know, there's people who are desperate to have children, who are desperate to be parents, and then I'm sitting there going, I don't want to do this again. When that's not the case at all. I would give anything to be able to carry another child after this pregnancy, and I hope that is the case, because I have enjoyed pregnancy. The second trimester was like a completely different pregnancy, and it was amazing to go from all that worry to like just being a different woman. And now I'm in the third trimester. So the second trimester through to the third trimester, I think the best bit about that was starting to feel baby kick. And even now that he's booting is in the ribs and the hips, everywhere, it's just such a nice feeling to have, just knowing that he's grown away in there and he seems to be comfortable, he seems to be stretching, he's doing his own thing. Just feeling that is like that to me is the best thing. I think also just knowing that for my personal circumstances, I've created a life with someone that I love, and I'm excited to see how our son grows and see who he takes after, see how amazing Darren's going to be as a parent, see how amazing I might be as a parent. Certainly challenging, but I think the thought of that just keeps me going. It keeps me thinking it's not long left until he's here, and yeah, I think they're the two best things about pregnancy so far. So the next question is, what are some of the risks associated with diabetes and pregnancy? So some of the risks, one of the major risks is that if I as a diabetic mother have high blood sugar, then it's going to cause the baby to produce more of its own insulin, and that hormone insulin is what causes an excessive growth. So it's not good that a baby has an excess of growth. It's not good for the mother because she has to give birth to a big baby, but there are complications associated with a bigger baby as well for the baby. That's one risk associated. In the first trimester, if I as a type 1 diabetic mother always have high blood sugar, then it's going to cause abnormalities in the fetal growth. So certain aspects of the baby won't develop properly, such as the limbs, the organs, the brain, everything like that. More serious, and again this might be a trigger, but if blood sugars are continuously high, then it could lead to miscarriage or even stillbirth later on in pregnancy. So there's just a couple of risks associated with diabetes and pregnancy, so it's always best to get on top of it as soon as you find out you're pregnant, if you do have to manage type 1 diabetes. The next question, what moments are you most excited for once baby arrives? That's a lovely question, isn't it? Obviously I'm excited for him to meet the family, I'm excited for my family to meet him. I'm just waiting for this whole situation to just blow over, she says, a year down the line. But yeah, when this situation does blow over and my family finally get to meet him, that fills me with a lot of love. A lot of love. Do you have a going home outfit for baby yet? No. Now I was looking this morning because I was thinking I would like to film, well, I'd like to start packing the hospital bag for a what's in my hospital bag video. And I thought, well, I need to get a going home outfit. I mean, it's not important to have a going home outfit, but it's quite a pivotal moment, especially the fact that I'm high risk. There is the chance that baby might need to stay in hospital a little longer than necessary, so hopefully that's not the case. I'm praying that that's not the case. As long as everything goes to plan, then he'll be coming home normal time, just as a normal healthy baby would. In the event that he does need to stay in hospital for a little longer, it's quite a pivotal moment from that point for him to come home. So yeah, I definitely want to get a going home outfit. And I have been looking this morning to see if there was anything that I quite fancied for him, but nothing was jumping out. I would love to get something that relates to Darren's hobby. You'll know Darren's hobby, he enjoys collecting dart frogs. I've talked about this many a time on my channel, and it'd be quite nice to have something to do with that. If I can find anything at all to do with that, then I will certainly look to get him an outfit with that hobby on. I am totally unorganised at the moment, but the plan is to have a going home outfit, and once we get one, I will show you in the what's in the baby's hospital bag. And the last question, I like this one as well. Have your dogs reacted differently to you now you're pregnant? Straightforward answer to that is nope. Haven't changed one bit. I've got 2 French bulldogs. They're both male dogs, so I don't know if it would be different if they were female dogs. They might have a different kind of sense, like a 7th sense or something like that. But certainly with my 2 male dogs, they haven't really changed at all. They know no boundaries, these dogs. So if I'm sat there on the sofa, bump hanging out, in pain because his elbows in my ribs or whatever, the dogs will jump up and they'll just plonk themselves straight onto the bump with no consideration that there's a little baby in there. They don't sniff around differently. They didn't do that before I found out I was pregnant. Like at that time when I was pregnant but I didn't know, they didn't act differently then. So really the short answer to that is no, there has been no change in the dog's behaviour, and they're just as wacky as ever. I am looking forward to seeing how they react when baby Sims arrives. The little one, Dallas, he has got a tendency to kind of just like flick switch, and it's a little bit concerning. So we are actually going to get him neutered in the hope it calms him down a little bit, because I would hate the thought of him getting a bit too out of control when we have a newborn in the house. So we'll see how that goes. Fingers crossed that all works fine. But yeah, like I say, short answer to that is no, the dogs haven't reacted differently to me being pregnant. But it's quite nice because I like the dogs as they are. It would be nice if they were a little bit calmer, but no, they are just their wacky selves. So that is it, everybody. That concludes the questions for the pregnancy and diabetes Q&A. If there's anything else you want to ask, do leave it in the comments below, or follow me on my Instagram. You can message me there asking any questions that I haven't answered today. And hey, if I get any more, I might do another Q&A, so stay tuned, subscribe if you haven't already, and hit that notification bell. And I will see you in my next video. Bye!